I'm Dr. Malia Jensen. Welcome to Dr. J's Prescription for Health. We have a special birthday in the house. This is Tootsie, and Tootsie is 7 today. So if you guys could wish Tootsie a happy birthday, I would really appreciate it. Please tell her where you're listening from. She would love that. And she's pretty shy, so I don't think she's going to stick with us, right? But she knows it's her birthday because I've been telling her, and I think she would love to hear from all of you guys. She's 7 today. And for her 7th birthday, she has asked if she could, in her name, donate to a rescue where she got her brothers. And I talked about this yesterday. Tallow and Buddy Blue are from Rescue Rehab and Rehome, and we are raising money for her in her name for them. So if you guys could let Rescue Rehab know that you are wanting to donate to them. I put the link in the description on YouTube as well as Instagram, but Instagram, you have a live fundraiser button that you can donate to. So I'd really appreciate it. We have $35.60, and we're trying to raise $100 in Tootsie's name. Okay, so this is my Tootie girl. She goes by Tootie girl, and I was singing to her today. But we'll get started. This is Tucker. Tucker is co-hosting from heaven, and that is Buddy Blue in the background. And so when I put Tootsie down, he's going to probably take his spot where he normally is. We'll get rid of, move Tucker because he's so shiny, he reflects into the camera. So we don't want that. So Steph says hello and happy birthday. Okay, you guys, this is Tootsie. She's 7 today. Great that it fell on her on a Sunday. So this is good. Okay, so we'll let you go back to sleep, baby girl. Hmm. Yeah, she's so shy. Oh my gosh, I just love her. She's gonna get a haircut for her birthday. And I was gonna make her steak, and I ended up doing ground beef. She loves ground beef. Yes, you do. I know you do. I know I do. And we might eat twice today, just for you, okay? All right. You go have a good nap. Oh, okay. All right. So we're back. We're going to talk a little bit about liver today. Oh, I know she's such a sweetie. Thanks, stuffed birdie. I appreciate it. Let's see. Oh, Summer Love says happy birthday. It's not me. It's Tootsie. Tootsie's birthday today, and we're raising money for her in her name, not for her, in her name to Rescue Rehab and Rehome. And the donation button or the link is in the description. But you Instagrammers, you actually have your own live fundraiser link, so you can do that. Please, if you're on YouTube right now, if you're on Instagram, please hit the thumbs up. I would really appreciate it. Thank you. It's okay, Summer Love. My birthday's in May. I already had it. Come on, jump up here, Buddy Blue. Let's go. Come on, up. Do your thing. Come on. There he is. Okay. He didn't like that his sister took his spot. Hi. Okay. Yep. The camera's on you. It is. Would you like them to see you? Look, Buddy, I don't know if you guys can see. He's got a very large scar on his belly. So he was one of the rescues from Rescue Rehab and Rehome. I rescued him for my birthday. But we do not know where that scar came from. But he is alive, well, and I don't think he realizes he's got a scar on his belly. And it just is nice for him. You go lay down. Now everybody thinks they can come up here, even Tallow, and he's bigger. Okay. Okay. All right. Lucy, thank you for being here. We'll get started. Lucy is she is my blue shield, my moderator over there on YouTube. We sometimes need that for special people over there. And yes, happy Father's Day to everybody. My dad is he listens in on every one of my reels and every one of my live streams. He's always been there for me. I miss my dad terribly. So for those of you listening right now who still have their dad and they have a wonderful relationship with him like I did. Oh my gosh, love him up today. And just because you know that they will not be here forever. And I'm guessing that it's going to be a long time for me before I see my dad because God has so much work to do in me that I'm sure I'm going to be a century old and maybe even longer because he's given me all of this brilliant knowledge to share with you guys and share the gospel. Yeah, Lucy, I bet you do. It's tough, isn't it? My dad was my bestie, and I really respected his opinions and his guidance. And so now without him, I'm relying heavily on the Holy Spirit, which I should have been doing before. But the Father is dwelling in me, and he says, your dad is just fine. He'll wait, and everything is going to be fine and dandy. So, anyway, happy Father's Day to you guys listening who have fathers or you who have a special relationship with your dad. Thank you. All right. Liver. We are going to talk about liver and cholesterol and liver flushes and gallbladder and sludge and all of this stuff because you guys have so many questions. I mean, and it usually is a lot of repetition on the questions. But okay, how about this? There is a connection between high cholesterol and a bad liver. And there is even a connection of high cholesterol and a lack of a gallbladder. We are all too punchy to get our gallbladder removed before trying other things. Now, the doctors are not going to give you the other things to do, but you guys know that there is a healing process that you can do to get that liver functioning again. If you think that you can take a liver flush that is being promoted online, like some sort of olive oil or lemon juice to expel gallstones, think again. Those are really not gallstones, but they're actually saponification. So basically, you're making soap. You have taken the oil and the citric juices and you've made a green soap ball. Okay. It is not a gallstone, and you likely will end up keeping those. Okay. True liver healing requires an understanding of the cellular function, not just, that's a good point. James says fasting is the best. I can agree with that, but we're going to go into why fasting would be a good choice and what is fasting or another type of diet actually helping. But the true liver healing can still occur even if you don't have a gallbladder. So that was a big question is you guys think, well, I'm doomed. I don't have a gallbladder. I can't do anything. No, you can. It's just that the gallbladder is in our body for a reason. And your doctor likely said, you don't need it. It's just an incidental organ. I don't think God made incidental organs. It has a job to do. The gallbladder is not only storing bile, it's concentrating bile. It removes the water, and it's 10 times more concentrated than bile when it is actually secreted by the liver. Now, you can still get by without the gallbladder. It's just that the liver is going to continuously drip bile into the small intestine rather than it being stored and concentrated. So it's going to be thinner and less concentrated. So it doesn't work as good. It still works, it's just not as good. And if we don't have a gallbladder and you don't eat particularly well and you don't fast, then you are in trouble for that bile backing up and causing sludge. Okay? It's it's basically an upstream. We got to stop that. Can we stop that gnawing stuff? He's gnawing on something, like his toenails or something. Okay. All right. Yes, I fast for 24 to 36 hours once a week, says Henry. So you guys seem to be doing a lot of fasting for liver. I I can't deny that. He is chewing on his toenail. Oh my goodness. Oh my goodness. All right. Why don't we, let's see. I don't know what that question is about. Yes, fasting does remove old cells. It's called autophagy. We go into autophagy when we fast. We go into autophagy when we go into ketosis. Now, back to the liver thing. The liver can get congested because of our diet. If we are consuming high amounts of sugar, glucose, fructose, seed oils, processed foods, we can get a liver that is full of triglycerides and it becomes fatty. It's called non-alcoholic fatty liver disease or metabolic associated fatty liver disease. Either way, they give it a new name because they want you to know that they're onto something as if you didn't know that, but they want you to know that they're now smarter and they're going to call a different diagnosis instead of non-alcoholic fatty liver disease, they're going to call it metabolic associated. So they're actually telling you that if you have high insulin, you risk having non-alcoholic fatty liver disease. When we check labs, this is very, very important, you guys. You know how I'm always harping on you guys to check the reference range as compared to an optimal range. If you were to read the complete metabolic profile at the ALT and the AST, the reference range will go up to 45, even 50 in some cases. This is not optimal. That tells me if your ALT and AST are over 15, your liver is struggling. Your liver cells are leaking enzymes because they are struggling. So an ALT and an AST between 10 and 15 is where you want your labs to be. You also want to get a GGT, okay? A GGT, a goal, optimal goal is less than 20 on your reference range. It could go up to 100, you guys. That is not normal. That's bad. It is telling me that your bile ducts are not well. The next thing you want to look at besides ALT, AST, and GGT is an ELK phos, ALK phosphatase, ELK phosphatase, ELK phos. That number should be less than 100. If it is high, it's telling you that there's likely sludge and a backup in your bile ducts. Your ducts have sludge and they're irritated, inflamed. They're not doing well. The thing with the liver enzymes and gallbladder, you guys, there is no way you can take back if your gallbladder is gone. So there's no real reason to dwell on it. Okay. The gallbladder is gone. There's nothing you can do. Sometimes the ducts coming out of the liver will build a little pouch for extra bile, but it's not going to concentrate it like the normal gallbladder would do, but it's better than nothing. So if you've had your gallbladder removed, it would be a good idea that you eat, if you're going to eat a fattier meal, if you're going to try to get into ketosis, you're going to lower your carbs to less than 20, you'll probably end up increasing your fat. You just need to be careful. You don't want to eat a big fatty meal all at once because it could cause fatty stools and diarrhea because you can't process it. So you want to eat smaller fatty meals, okay? Now somebody asked about TUDCA, TUDCA, TUDCA. TUDCA is a naturally occurring water-soluble bile acid. It can thin out sluggish bile that you have present right now. Is so if you have a backup, your liver is fatty, you have metabolic associated fatty liver disease, then you could initially, for a short period of time, take some TUDCA and get things flowing again. If you get things flowing again, your liver can decongest, okay? And that is important because if your liver is full of fat, triglycerides, it's going to try to package them up in VLDLs and send them out into the bloodstream. If the liver is fatty, it really doesn't want any more fat or energy coming into it, okay? So that means when VLDL is dumped into the bloodstream, and then that VLDL dumps some of its triglycerides off as energy, and it leaves an LDL. And then the LDL dumps its cholesterol into cell membranes and tissues where it's needed. And then the HDL picks up the remnant cholesterol and delivers it back to the liver. Guess what? If you have a fatty liver, and it's backed up, non-alcoholic fatty liver disease, or the other name is metabolic associated fatty liver disease, then your liver is not going to take that LDL up, and it's going to stay in the bloodstream. When it stays in the bloodstream, you guys get an elevated LDL. You do not have a deficiency of some sort of pharmaceutical. You have a backed up liver because it is fatty, and it got fatty for the most part from seed oils, glucose, and fructose. If you're an alcohol drinker, that adds to it, compounds it. Do you guys have questions so far on this liver thing? Uh, 6 on the dice says, is raw milk and raw meat better for you to consume? Better as far as what? Are the only mammals who eat another mammal's milk or drink another mammal's milk after the age of 5? Do we need milk in the first place? And what is it about raw meat that you think is better? Let us know. And yeah, please, Lucy says, if you have a question, please put a QQQ in front of it so I can see it right away, or use a super chat, and that helps the channel, and it helps to accelerate your question to the top of the list. Chauncey says, I haven't drank alcohol for 2 years. Awesome. Congratulations. Henry says, been on a keto diet for a year with weekly fasting and a lot of omega-3s. My triglycerides have decreased to 33. That's incredible, Henry. That's awesome. Thank you for sharing your story. You're using your triglycerides very efficiently. You're insulin sensitive. Okay. Yeah. All right. I'm not seeing the QQQ, and it's hard for me to read through your comments. Instagrammers, do you have any questions in regards to all of this? I know some of you have just jumped on. We were talking about the gallbladder, or lack thereof of a gallbladder. We talked about the liver being backed up, usually from starting with our diet, whether if it's high in glucose, fructose, or seed oils, as well as alcohol, can cause a fatty liver. Fatty liver can progress. It gets inflammatory. If it gets inflammatory, it can get hardened, called fibrosis. If you have fibrosis, there's levels of fibrosis, and usually a GI doctor can determine what your fibroscan is. If you have fibrotic liver, you are on your way to a cirrhotic liver, and there may not be any coming back to that from that, okay? And it's very important that we, as physicians, know that an early ALT above 15, or AST above 15, or a GGT above 20, or an ELK phos above 100 are telltale signs that the person's got something going on. And many doctors do not treat this early enough. They're not looking, they're not metabolically inclined to look at your liver and to even relate that to high cholesterol. They're just going to give you a pharmaceutical to lower your cholesterol when really you need to, I don't want to say flush out because I don't want you to flush out. I need you to reverse whatever liver condition you have going on, whether it's early and it's just fatty liver, or if it's inflammation, fibrosis, or cirrhosis. What stage are you guys in? A lot of times, the enzymes that are secreted from the actual hepatocytes, they are late in coming to the party. Meaning you could have liver disease well before your liver enzymes start going over 15. And if we let that go to 45 or 50 before we start mentioning it to the patient, think how much inflammation led to fibrosis could be leading to cirrhosis. They can go from 45 to 50 upwards to 300 in a matter of a blink of an eye with and we missed it. We missed it early. Okay? That's something that you guys now can um now be well aware of. James says, "Let's go Dodgers." Yeah, let's go Dodgers. They play the Orioles today at 3 p.m. So yeah, 3 in a row wins. Dodgers. Okay. Henry says, "Yes, Dr. J, my insulin is at 3. So that's why your triglycerides are so low." Diana says, "How to improve neuropathy? What is the cause of your neuropathy?" And then you can work on improving it. Um, Bexa says, "I don't have diabetes that you know of, I'm guessing, but get hypoglycemic often. What could be the cause?" It could be diabetes. It is likely insulin resistance. You have sky high insulin. It is an earlier sign of your diabetes. And I don't know what your A1C is. I'm guessing if you say you don't have diabetes, it's under 6.0. If it's over 6.0, you do have diabetes. Okay. But getting an insulin level um, will help you know that you likely have something else underlying going on, and it's likely diabetes. Okay. That's why you're getting hypoglycemic episodes. You'll eat something and your pancreas is secreting a ton of insulin to try to keep your blood sugars down. And then when that insulin is secreted, it actually bottoms out your blood sugars. Then you go and eat, and you'll eat something sugary, spikes glucose, you pump out more insulin, and it does the whole thing over and over and over again. It is in your best interest to get rid of glucose, fructose, seed oils, and allow your liver to function, to reverse it. You have fatty liver disease, and to allow that pancreas to understand it doesn't need that much insulin and it can rest. Okay, good question. Who's Lucy says, "I've been seeing a lot of posts about castor oil for liver flushes." That's exactly my point. It could be castor oil, it could be olive oil, it could be citrus juices, and it's not really clearing, in my opinion, it's not clearing the gallstones. What it's doing, Lucy, is the process is called saponification. And it's basically, the other name for it is like making soap. So when the oil and the citric acids meet together, they form this green soap ball. You think it's a gallstone. It is not. It is not a liver gallbladder stone. It is not. Now, are there other gallstone blockers available? Yes, but simply using an oil and a citric acid, I can't get on board with that because I don't think it's good for us to be making green soap balls in our body. Okay. Yuli says taking certain medications can cause fatty liver as well. So what medications are those, Yuli? Perimenopause, menopause as well, due to lack of estrogen. Estrogen blocking medications for breast cancer survivors make things worse. Okay. But in order to get fatty liver, you need a hormone that builds fat, and that hormone is insulin. Now, if it is not entirely estrogen, estrogen will tell you where to store fat, but it doesn't tell you how much fat to store. Insulin is that hormone that says, uh-oh, so if you have high sugar diet, glucose and fructose, you drink alcohol and you eat seed oils, you will get fatty liver, okay? Now, if you're also on prednisone, that raises blood sugar and that can lead to fatty liver. There are medications for that are psych medicines that can increase um, fat production. Yes, to answer your question, yes, there are medications, but you're leaving out the big hitter, the big player, and that is insulin. And we need to keep that insulin level low. Get an insulin level, Yuli. If it's over 5, then it's high. And you're asking about statins as the only solution for women in this situation. What situation are you in? Because you do not have a statin deficiency. You have a liver problem that can be reversed. Okay. If people aren't getting enough choline to make phosphatidylcholine in order for the bile, and where do we get choline? Eggs, the yolks. We also need glycine and taurine. If you're not getting all of these amino acids, then you are unable to really concentrate bile and to bind bile acids in order to excrete them. And I would say that a majority of the population is low in glycine. And they could be low in taurine, especially if they're a plant-based eater, especially if they're eating a lot of peas, pea plant powder, and all of that, because it naturally lowers or binds and causes the taurine to be depleted. So, and then if you don't have taurine, then your heart's going, is at risk because you need taurine. So you can see that a diet that is full of processed foods, seed oils, and sugar is not only hard on your liver, it's hard on your heart and all the other organs. Okay. All right. So, yeah, I don't think you have a deficiency of a statin. You need to change your diet, Yuli. All right. Um, Prash, how to improve iron levels. Hemoglobin is normal. So, what I need some raw numbers, Prash. I can't even begin to guess where your thought process is. Where is your iron? If your hemoglobin is normal, what kind of iron are you consuming? Are you consuming non-heme iron from plants and synthetic vitamins? Are you consuming heme iron from animals? What is your liver function? What is your copper level, your zinc level, your ceruloplasmin level, your selenium level? There's a lot of questions I would check. If you were a client of mine, I would also look at your MCV on your CBC. MCV, Mary, Christopher, Victor, MCV. So sorry I can't answer your questions, Prash. Okay. Henry says, what inhibits the conversion of T4 to T3 liver function? Well, if you are inhibiting T4 to T3, you're likely producing large amounts of reverse T3. And reverse T3 can go up for a number of reasons. Is insulin resistance one of those reasons? Yep. Fatty liver? Yes. Stress? Yes. Low calorie diet? Yep. You also need cofactors, amino acids, vitamins in order to convert T4 to T3. In other words, Henry, there's a lot of things that can block the conversion and things need to be looked into, and initial labs do help. Colorado says, do you think that the pharmaceutical industry is out of hand with the commercials that they project all the time? Look at the side effects and the Hippocratic Oath. Don't they conflict? Well, to a doctor, the Hippocratic Oath actually could promote the fact that if you first cause no harm, that means do the medicine, because if you don't give the medicine, then you could be causing harm. There's so many twists on this, and I understand exactly what you're saying. You're talking about direct to consumer advertising to a patient. I personally don't watch much TV, if at all, unless it's a game, a sports event. I watch a lot of sports, but otherwise, I'm not watching much TV, and I don't see the pharmaceutical direct to consumer advertisements as someone who watches more TV than I do. Do I see a lot? Yes. Do I think that is a negative or a positive? I think it can be both. Negative meaning the patient is being cognit they're being led to believe that the only way to fix whatever problem it is that they have, they need a pharmaceutical. And so that pharmaceutical direct to consumer advertising is always in the background of your brain, convincing you that you can't fix anything and you need a pharmaceutical. And so you will take that information to your doctor. Now, for me, it opened up portals of conversation. If somebody brought that up, and then I knew that they were at least using their thinking cap and wanted to ask about more information, like, what are my thoughts? So for me, it worked both ways. Now, if I was a busy practitioner seeing 40 patients a day and you brought up, hey, what is Tremfya? And I think that would be good for me. I don't have time. I wouldn't have time to speak to you about that particular medication. All right. And then I would either blow off your question, or I would just go ahead and give it to you. Oh, you want that? Okay, here you go. So I think there's both ways. I don't know how to answer that, Colorado. Me personally, it's a learning experience for me. If I don't know what new psoriatic medication is out there, I won't have the opportunity to get educated. And sometimes those commercials give me just a little bit of knowledge that I need to maybe look into. And I go, oh gosh, there's something new out. Should go look into it because a client could come to me and be on this medication. Colorado, I hope that answers it. I'm not saying it's good or bad. It just depends on the all the variables, okay? Uh, Prash says, I am vegetarian, pure vegetarian. So if you are pure vegetarian and you're not eating any heme iron, then the iron that you are consuming is hard to absorb. Only 3% is absorbed. There's a possibility, a strong possibility, that since you are not able to absorb it, you have a lot of iron that is stuck in your liver and other tissues. It's locked up, and you would need further testing. Most vegetarian diets are low in glycine. Most vegetarian diets are they're high in zinc. If you lower your zinc or raise your zinc, you're going to lower your copper. You need copper in order to prevent iron from being driven into organs like the liver. So you could have a very, very low ferritin level, or in some cases, your ferritin level could look high. So you have labile iron stuck in um, your tissues, and it could look like you have low iron when in all reality, you have iron overload. And you likely could be low in copper. Oh, so call it okay. All right. So I guess we can't read Copper's or Colorado's stuff. Okay. Okay. Melanie asks a question. Is the muscle pain associated with statin muscle cramping or some other type of myalgia? Does CoQ10 help for this? Yes, it does. So the reason you have myalgias, muscle aches, algia pain, muscle, algia is pain of the muscle. It is from the lack of CoQ10. So most doctors will tell you to take CoQ10. It shuts down mitochondrial ATP. Can you just take CoQ10? You could, but you need to be able to break down CoQ10 into the usable form called ubiquinol. Should you take ubiquinol? I would say if you're over the age of 50, do not take CoQ10. Take ubiquinol for your muscle aches and pains if you want to remain on a statin. Lynn says, if one statin causes muscle pain, would trying another be a different story? It would be an option is to try another statin and see if that one causes any problem. There is a difference sometimes between the fat soluble ones and the water soluble ones. So there might be a difference between atorvastatin, which is Lipitor, and rosuvastatin, which is Crestor. So the atorvastatin will cross the blood-brain barrier. The Crestor will not. The rosuvastatin will not. So if you want to remain on a statin, yes, try a different one. Okay. Good question. Okay. Any other questions, you guys? This is your opportunity to ask questions. Melanie, did I answer? Okay. Oops. Okay, Melanie says the video froze. Okay, Melanie, if you're still there, let me check the question. Oh, it was about CoQ10. Melanie, are you there? So put a wave or something so I know that you're still listening, and I'll go over it again. The fact that you take a statin, a statin blocks the mevalonate pathway. The mevalonate pathway produces CoQ10, vitamin D, GLUT4, uh, a whole bunch of stuff, vitamin K, isoprenoids, all of these things. If we block the mevalonate pathway, then we don't get CoQ10 production or very little of it. And yes, this can lead to muscle aches and pains. If you're over the age of 50, I probably would not take CoQ10 since we, over time, over aging, we lose the ability to break down CoQ10 into ubiquinol. So it might be in your best interest to take ubiquinol instead of CoQ10. Okay. Um, Henry says pitavastatin, the other name for pitavastatin, I believe, is Livalo, is the only statin that has never caused any noticeable side effects, but it is expensive. And so says Henry. And I have had a lot of patients who have taken Livalo. And if you do buy the branded, it does get expensive, but it's now generic. So it should be a lot more cost effective if you do want to stick with pitavastatin. I believe I'm saying it correctly. The other name for it is Livalo. As far as side effects, I've had patients who've experienced less side effects on Livalo than any of the others. Okay. All right. Off the way, how do you do a natural kidney cleanse other than cranberry? I don't know why you would want to do a natural kidney cleanse. Why is your kidneys need to be cleansed? Do you have chronic kidney disease? What was the cause of your chronic kidney disease? Is it blood pressure? Is it sugar? Is it high uric acid and low glycine? What is the cause? A simple liver or a kidney cleanse might, if I were to know of one, I do not, then you're basically cleansing it for that 5 or 10 minutes, and then what are you doing to improve your kidney function? Okay, so Of the Way says, "I believe I have issues with pain and low flow." Pain in what, and how do you know low flow? So, to check kidney function, you wanna get a cystatin C, Cystatin, cystatin C dash C, okay? And you also want to check a urine microalbumin, and you can do a spot check, or you can do a 24-hour. But you need to check your kidney function, and don't just take something for what you perceive as a problem, okay? VM says, "What are some misconceptions about pulmonary embolisms?" I'm not sure. I don't know, what your question pertains to. I'm not sure. Okay, lower back ribs. Okay, I will go to the VA and get those tests. Great idea. A urine microalbumin, and actually the VA is very good about the um checking those labs. They're better than a regular PCP in checking a cystatin C or a urine microalbumin, okay? But asking would be in your best interest because they aren't going to just offer that. So you need to ask for those two tests, okay? Lucy says, "So low urine flow can be a kidney issue?" Yes. Yes. Could be prostate? Yes. All of those things. Anything that could obstruct the flow. You could have kidney stones in the duct. You couldn't have an infection, and that will decrease urine flow. It'll make more frequency, so many more times urinating, but very low amount being, excreted. Okay. Heart calcium score, my numbers are 0. So he said, I don't have to take anything. 74 years old, I exercise, try to eat very little carbs. My triglycerides have come down to a normal level. Okay, what is a normal level? Congratulations, first off. And then what do you consider a normal level? A normal level, according to Dr. J, optimal level is a triglyceride less than 70. And you want to, at the same time, have an HDL above 70. Okay. Uh, Of the Way says, "Doc, could you please repeat those tests that I can write them down, please?" Yes. So we're talking about the kidney tests to get a real accurate GFR, glomerular filtration rate. You want to ask for a cystatin C, Cystatin, cystatin dash C, cystatin C, big C. You also want to get a urine. So you're going to pee in a cup and it's going to measure albumin, microalbumin. It's going to measure protein in your urine. We are trying to rule out if your kidneys are spilling protein in your urine. You do not want to spill protein in your urine. Okay? That is a sign that your kidneys are working very hard. We also do not want to overhydrate because that causes the kidneys to have to work very hard to concentrate your urine. We need to concentrate our urine. If you are drinking a bunch of water that is diluting, then the kidneys have to work very, very hard to concentrate the urine, which is healthier. You want a light yellow straw colored urine, not because of vitamins, because the kidneys are doing it. Okay. So cystatin C and a urine microalbumin. Okay. How VM says how to manage elevated LP little a, LP little a, lipoprotein A. How do you manage it? Elevated. I don't know what your definition of elevated is, but let's say it's over 30. How do you manage that? I have seen LP little a's come down on a carnivore diet. I have seen LP little a's come down on weight loss. So LP little a in and of itself, they will tell you that it is the most important risk factor. And if you have high LP little a, you're going to have a heart attack. It's done deal. It's an independent risk factor and you're just going to have a heart attack. Well, LP little a is actually a good thing as long as the level is not too high. Okay. The, the, the amount of LP little a is a protection if you have an injury to the lining of your artery. And if you have constant injury, your LP little a is going to run to the scene of the injury and try to patch it up. It's like a Band-Aid. It's the thing with LP little a is it actually prevents blood clots from breaking down. So you don't want to bleed to death. You want to fix the injury in the lining of the artery, and that's where LP little a comes in. So we are been taught to look at LP little a as negative when we do need some LP little a as a bandage, as a wound repair. And we're giving LP little a bad rap, and we're calling it genetic, and we're calling it all bad, just like we do an LDL. An LP little a not only has an ApoB on it, it also has an ApoA. That ApoA makes blood clots stick around longer. It helps blood clots from not being broken down, not dissolving as quickly as maybe you would like, but it's fixing an injury. Now, LP little a is one clotting factor that I like to have people get. I also like to see a fibrinogen level, a factor 5, a factor 8. I want to see even a PT and an INR. I want to see a prothrombin mutation level. I want to see if you have any risks for blood clots. And then I calculate how many do you have? If you have fatty liver, you have one right there because fat, visceral fat, secretes a hormone called PAI1, plasminogen activator inhibitor 1. Guess what? Prevents the breakdown of blood clots. That's just from fatty liver. Then if you have LP little a, there's another risk factor for blood clots hanging around. Then what if you have factor 5, Leiden, or factor 8, or you have a prothrombin mutation? Now you could have 5 different reasons for having blood clot form overactively in your body. And you guys know that a blood clot in all the wrong places, like your brain or your heart, can cause a brain attack or a heart attack. The LP little a in and of itself is a sticky little guy. So if there's an injury, he needs to stick to the injury. But that can be a good thing. But then it could be a bad thing. God did not make a mistake with what we have going on, but we as man have given it a name, and now we call it a mistake. You have it, it's a mistake. It is not a mistake. They didn't tell you to stop the injury, and we wouldn't have a problem with LP little a. Okay? Um, Lopris Lop, I'll just say Lop. Great morning, Doc. Any recommendations on flushing bile sludge to improve kidney health? If we are purely wanting to thin bile sludge, I would use TUDCA, TUDCA, for a short period of time. TUDCA is a naturally occurring bile acid, water-soluble bile acid. It thins sluggish bile to clear the bile ducts. That would be, I mean, I'm not recommending it. This is for information purposes only. You asked what a natural recommendation on a flushing bile. Can't really make a recommendation, but is there one? TUDCA. Is it a Jackie Robinson jersey? No, it's a Freddie Freeman jersey. Number fiver. Let's see. Trimethyl, trimethylamine. TMA, TMA, TMAU, Lorraine? Is that what you're asking? VM, I do not know the answer to that question about transcatheter valve therapies. Sorry. Okay. TUDCA is a naturally occurring bile acid thinner. Okay. It's water soluble and helps to thin sludge. Okay. Habanero says, hello, doctor. Hello. Okay. I think I answered that other question on the. Okay, here's another one. LDL of 191, HDL of 59, triglycerides 141, non-HDL cholesterol calculated at 219. Definitions. Let's do definitions here. Non-HDL cholesterol of 219 is adding up, calculating everything but HDL. It's non-HDL. So it's LDL, IDL, VLDL, LP little a, triglycerides, all of these things are non-HDL. Does non-HDL tell us a whole heck of a lot? No. But in your case, Dreezy has an HDL of 59 and a triglyceride of 141. That triglyceride, VLDL, is what's raising your non-HDL along with the LDLs that you have at 191. Now, because your triglyceride to HDL ratio is over 2, that tells me that your LDL count of 191 has a lot of small, dense LDLs, and those are bad guys. They are the bad guys, so to speak. They are very sticky, they're small, they're oxidized, they get bad quickly. Your triglycerides are elevated because you likely consume a high carbohydrate diet. So your liver is actually the liver I started talking about when I opened up our conversation. You have a fatty liver. You might have sludge in your bile ducts. I do not know without looking at your labs. But with a triglyceride of 141, you likely have elevated AST and ALT, not always, but you likely have fatty liver. So your liver is choking on its own fat. And so it doesn't want to take back any more LDLs back into the liver. So it's going to leave LDLs stuck in the bloodstream. And when they're stuck in the bloodstream, Dreezy, you are at high risk of a heart attack and a stroke. Why? Not because of the LDLs. It's because the liver is trying to unchoke itself. So it is taking triglyceride, the fat, and cholesterol and packaging it up into a VLDL. That VLDL, when it gets sent out into the bloodstream, will encounter all of your LDLs. It's like you're on a highway and you just threw a whole bunch more cars on the highway. So they're going to start bumping into each other. If an LDL bumps into a VLDL, a reaction can take place. That reaction involves CTEP, C-T-E-P, CTEP. And CTEP will cause an exchange of inner components. The VLDL will dump its triglycerides into an LDL. It is not supposed to be in an LDL. Triglycerides should have been emptied of the triglycerides a long time ago. That's the VLDL that has triglycerides. And those triglycerides are not supposed to go to a LDL. They are supposed to go to tissues for energy, but your tissues, they don't want any more energy. They've closed their doors. So this VLDL and this LDL can collide, and CTAP will cause an exchange of their inner components. So VLDL will dump its triglycerides into the LDL, bad news, and the LDL will give its cholesterol to VLDL, bad news. Now, the LDL is basically naked. He's a naked skeleton, and he can be easily oxidized. He can be damaged, and he will shrivel up because when the LDL has those triglycerides in it and no cholesterol, it's basically shriveling, and it shrivels into a small, dense LDL, the very thing that you don't want. Dreezy, that's why your small, dense LDL count is likely, I'm only speculating, high. Fatty liver. What do you do about it? Not medical advice. Change your diet. Your trigs are high because of glucose, fructose, alcohol, and seed oils as the four main components. Okay. That was a good one. Good one. Everybody learned on that. I think everybody learned on that. JMC, I would not use ox bile. I think it's too harsh, and you don't want to take more bile. You want to thin your bile. You don't want to take more ox bile. We get that in our head that because we don't have a gallbladder. Now, here's one caveat. Let's say you go from a standard American diet and you want to get your gallbladder start working again, because when you are eating a standard American diet, your gallbladder is actually hibernating. It's not doing anything. Okay? Your gallbladder has been sleeping because there's no real fat coming through that the gallbladder would need to contract and secrete bile. So that's why we get gallstones. One of the reasons we get gallstones is that the gallbladder stops contracting. It doesn't think it needs to contract. So it gets what we call flaccid, weak. He's a weakling and he can't squeeze. So if we give ox bile, it could at least help relieve the gallbladder a little bit while you slowly add fat into your diet. Saturated fat, good fat, even monounsaturated fats, but not polyunsaturated fats. That's processed crapola. Okay? That's good stuff. You guys are bringing up so many great points. You guys are thinkers. I love it. Dreezy says, wow, thank you. You're very welcome. Chanel says, why would my triglycerides jump from 63 to 91 in 3 months? It could have been something you ate within the past 48 hours prior to getting your blood drawn. It could have been your exercise routine 48 hours prior to getting your blood drawn. You could have drank some coffee right before getting your blood drawn, and the triglycerides can come up. Those are just a few of the things that can that could have caused the problem and elevation. Okay, did I miss anything? I probably did. Now YouTube is getting very, very active. VM says, which autoimmune conditions have shown the most consistent improvement with carnivore diets? I'm guessing all of them. I don't know for a fact. Maybe listen to, I would probably listen to Ben Bickman, Dr. Ben Bickman, Dr. Sean Baker, and Dr. Anthony Chafee if I wanted to learn more about autoimmune, decreasing autoimmune disorders with a carnivore diet. Okay. Habanero says my cholesterol was 646 total, 526 LDL, 198 triglyceride, HDL 85. Did an NMR 3 weeks later. totally different numbers. 502 total cholesterol, 396 LDL, 107 HDL. Okay. Okay, you did an NMR and you first did a just a normal lipid panel. A regular lipid panel is not going to be as accurate. It is also skewed. So because your triglycerides are so high, you can't really measure your LDL. So it's skewed. That result of 526 is a skewed level. But for the most part, you still have what is considered an elevated LDL at 396 on an NMR, which is an advanced lipid test. So it's probably more accurate on the NMR. Okay. Now, with a triglyceride of 118 and an HDL of 107, I would be more inclined to believe the NMR, but 3 weeks later, again, the previous 48 to 72 hours can still affect the triglyceride level. So you need to be consistent, or you should be consistent with time of day of checking your blood. So every time you go in, it's 10 a.m. Every single time you got to be consistent. Also, sleep, the amount of sleep matters. Also, what exercise routine you did in the previous 72 hours matters. So you want to be consistent with your exercise routine prior to every blood draw. So don't really scratch your head. It could be something as simple as you were going into a different lab, you were in traffic, you thought you were going to be late, your cortisol went up, blood sugar went up, triglyceride went up. I mean, there's so many things, but maybe you recheck one of those, maybe you do a recheck an NMR again, and you do it at a consistent time with consistent sleep, consistent exercise, consistent coffee, whatever. Just be consistent with the time of day that you're doing anything, okay? Reggie says, my skin is falling off and it is now bleeding, etc. You need to see your doctor. Go see your doctor. See a dermatologist. Okay. Mike says, I wish for a cure for celiac. I would do a dietary change for one. I would do an elimination diet and see if what is you're eating that is exacerbating your celiac. Oh, you're very welcome, Reggie. I'm glad you're here. I'm glad to help. Casey says, how do you feel about creatine for athletes? Wow, that's that's a loaded question. A part of me says if athletes are eating a animal-based diet, they're likely getting enough creatine. Do we need more creatine for our brain? Possibly. Some studies are now showing that we need upwards to 15 grams of creatine a day, and we're not getting that in our diet. I don't even think I get 15 grams in my diet every single day. But I don't know if the studies are all there. Okay. I also worry about the contents of the creatine powder. Are there a lot of heavy metals which could end up affecting our brain? How do we know we're getting pure creatine? Is it all synthetic? So I wish I knew the answer, and I just don't, Casey. If you are taking creatine, you feel better on creatine, then take the creatine. Just, monitor for a good source of the creatine, monitor heavy metals. Maybe that's what you need to do. Chanel says, what do you think about HRT for lipids and heart health? I don't think that HRT is required to have heart health and for lipids, because your lipids could be going up for a reason, just like you went into menopause for a reason. Do you need HRT in order to thrive and survive? I would say no, God made us perfect. And if we don't mess with his perfection, our body should be able to take saturated fat from our diet, make pregnenolone. Pregnenolone can make progesterone. Pregnenolone can stimulate the adrenal glands to make DHEA. And DHEA can make androstenedione. And androstenedione can convert to testosterone. And all estrogens are made from testosterone. All of them. So if you are eating one animal-based diet with saturated fat, you can make the pregnenolone. If your adrenal glands are not a mess and you have good adrenal function, then you are going to get DHEA production. And then the cascade will continue on. So you get your testosterone and estrogen. Healthy body. Do we need HRT? If we have a healthy body, we're eating appropriately for our species, then I don't think we need HRT. But that, again, that has to be a decision for you. If you want to take a synthetic phytosterol, it is not cholesterol from an animal, it is a phytosterol from a plant. So you are incorporating a plant sterol as your HRT, hormone replacement therapy. You're incorporating a plant sterol, asking a plant to work in an animal body. If you feel great doing that and you think it's going to give you longevity, by all means, go for it. I don't know the answer. I'm sure that you could ask 100 people and you'll get 100 different answers. Okay, did the creatine question? Reggie says, I think it was stressed. I've inherited a massive amount of debt. Yeah, that can be a problem. I mean, that could be stressful, raise cortisol, increase blood sugar, increase insulin, increase fatty liver, all of that. Habanero says my particle size are LDL particle 32, so actually 3,300, all right? And that's high. Small particles are 570, also very high. HDLs are 38, which is low. So I think habanero, that you probably have what I thought was going on with that other person because you have so many LDLs in your bloodstream. You are being overwhelmed with sheer particle number. You could have a fatty liver. You could have an LDL receptor on your liver cells that are not working. You could have an FH, either heterozygous or homozygous. You could be an overproducer, or you could be a hyperabsorber. With just the NMR, it's not a good enough look to know what your actual diagnosis is. I can look at this just like anybody else and say, habanero, here's your statin, here's your PCSK9, and here's your Zetia, and let's treat it from all different directions, and we have no idea what your diagnosis is. I don't play that game. I want to know the diagnosis. And if you're a hyperabsorber, I'm going to say, habanero, I think you need to increase your fiber. And I'll tell you to take the fiber, or take Zetia. That would be the only medicine I would probably take for myself, if I was a hyperabsorber. Forget the fiber, I'm doing the Zetia. Much more powerful result. And I need to block my NPC1L1 receptors so it is not continuously being a vacuum cleaner and sucking out all of the cholesterol that it was meant to be put into the stool via a bowel movement. But you got to know, I suggest you would want to know your diagnosis before you just go blindly taking a bunch of medications. Psalms 90 says, how come you don't eat fruits or vegetables? I don't remember telling you I don't eat fruits or vegetables, but if I don't eat fruits or vegetables, there's a very good reason. There is absolutely no nutritional value that I need in my body. There are no essential fruits and vegetables. They only cause fatty liver, and they decrease the absorption of, because of phytates and oxalates and saponins and tannins, they block the absorption of the things that I want in my body, namely B vitamins. I don't want to have to take a B vitamin supplement. They block amino acids. I don't want to have to take amino acid supplement. I don't want to pay $25 for my ribeye and make it worth $5 by eating vegetables with it. I especially won't eat anything raw, as those are higher in oxalates and phytates. I will boil them until they're mush to get the oxalates and phytates out. And then by that time, I probably don't want the vegetable. But again, there is no essential fruits and vegetables. And personally, I don't eat them. Unless, of course, it's filtered through a cow. If a cow wants to eat a piece of fruit or some vegetables, go for it. I'll eat the cow. He's got a 4-chambered stomach, and I feel good about him filtering it for me. I'm not a ruminant animal. I am a human, and we do not have enzymes that break down that particular fruit or vegetable. It goes out in waste. Waste. So I wasted $5 buying fruit. Reggie says, love this doctor. Thank you. She's so realistic. Thank you. I hate how they just throw everyone on TRT. Lost a friend due to a stroke from his blood thickness. We get old and we naturally go down. Another thing, Reggie, before anybody takes HRT, they need blood clot panel. Do you know how many people I have found, especially men, oh my goodness, that go on testosterone therapy? They have factor V, prothrombin. Nobody ever checked their LP little a. Nobody checked their factor VIII. Nobody checked their fibrinogen level. And their hemoglobin hematocrit nobody checked their hematocrit. It was over 50. And do you know what the hormone people tell you to do? Just go dump blood. Go dump blood? Well, did you check and see if I have a blood clot risk factor? Because that's what every hormone replacement therapy should do, is get a blood clot panel. Okay? Everybody. When my guys were on testosterone, there was a time when I did a little bit. I probably had 5 to 10 people who were on TRT. And a lot of times they got it on their own, but I checked because I was their PCP. I checked their blood always. And I especially said, did they check you for blood clot factors? And they said, I don't know. So I checked them. And sure enough, that's when I started finding a bunch of factor fives, a bunch of prothrombins, high fibrinogen. That person is at risk for a heart attack or stroke, no matter what their age. Okay. I'm so glad you brought that up. Great, great thing that you brought up, Reggie. Thank you so much for spurring that on. Okay. Cami says, my AST is 26. Would TUDCA benefit the liver? If it's a bile problem that's stuck, that sludge, TUDCA could help. But if you have an AST of 26 and you got fatty liver disease, taking TUDCA isn't going to be the answer. It's getting rid of the fatty liver. The fatty liver is choking the liver. The fat is choking. John says, are supplements utilized by the body or not cholesterol meds keep being pushed by the VA? MC, I won't take it. John, can you rephrase that question? If it's a question, can you rephrase it? I don't understand. I'm sorry. Okay. Steph says 43-year-old female, low testosterone. How do we increase that? More saturated fat. You need to eat animal fats in order to make your own hormones. You need animal fats. You need cholesterol in order to make your hormones. That's why taking a statin that lowers cholesterol, or any medicine that lowers cholesterol, now lowers your ability to make your own hormones. Okay. Already practice keto, fasting, work out, lift weights, and get loads of sunshine and outdoor time. So it sounds like you got a lot going on. I don't know what your testosterone is, but maybe, just maybe, it is enough for you, Steph, and you don't need a bunch of testosterone. Okay? But definitely increase your fat content and get that, maybe increase, get that adrenal gland start working again. Maybe you're exercising too much. Maybe you're not getting enough sleep. Maybe you are a hypervigilant type A person. And no, your adrenal glands are going to be stressed. They're not going to be making testosterone. Is historically high insulin. Well, that'll decrease your testosterone. So insulin resistance and slightly still elevated. Yeah, I mean, that can lower testosterone. Dreezy says, I have severe stenosis of the spine. I will have an operation in July. I take 50 milligrams of tramadol in the morning, 50 milligrams at night. Has this affected my lipid numbers? Most likely, yes. Lynn says, if we are high risk cardiac, should we take GLP? You'll have to give me some more information. I don't know what high risk cardiac, what cardiac plumbing part, cardiac electrical part. I don't know what your cardiac is high risk. And why would you be taking a GLP? Is there something that's causing your cardiac problem that is deficient in GLP? Meaning, are you a diabetic? That's going to be low GLP. Are you obese? That's going to be low GLP. Are you eating a bunch of processed foods that block the production of GLP from your gut? That could be a problem. So if you have a cardiac problem, why not reverse the things that block production of GLP instead of taking a synthetic lookalike of GLP? Again, I don't have enough information to answer your question as appropriately as I would like. Steph, you're very welcome. Honesty is the best policy. Oops. Steph says, what if cholesterol is always already considered high? Again, I don't know what high is. High for the ADA, high for the American Heart Association, high for pharmaceuticals, high for what? And what is high cholesterol anyway? I mean, high cholesterol, you don't even really measure cholesterol. Cholesterol is carried in lipoproteins, in lipoproteins. Cholesterol doesn't float freely in our blood. It's calculated. So if you want to know LDL cholesterol level, get an LDL cholesterol level. I'm guessing you got a total cholesterol level. Okay. That means nothing. We can't even measure it. It's fake. Okay. Habanero says, I'm MTHFR compound heterozygous. So that is another, because that could increase your homocysteine level. And homocysteine is an irritant. Yeah, that just compounds it. You want to make sure that your B12 and your folate and your liver is healthy. If not, you also want to make sure that you have enough glycine. If you don't have enough glycine, then you can't get rid of methionine or neutralize methionine. Lot going on, Habanero. Okay. Habanero says, yeah, I'm not too cool on the medication thing. I don't take anything over the counter. Currently, I've been on carnivore almost 2.5 years. Okay, Habanero. If you've been carnivore for almost 2.5 years, are you eating organ meats? And are you eating cartilage, skin, bone broth? Are you getting enough collagen, enough to make collagen and elastin? So proline, hydroxyproline, and glycine. Are you getting enough glycine to neutralize the amount of methionine that you heavy meat eaters are getting? Are you getting enough copper because you're getting way too much zinc, not way too much, but you're getting a large amount of zinc, and zinc lowers copper. If you don't have copper, I'm telling you what, your thyroid's not going to work, your liver's not going to be functioning. Levels need to be checked, habanero. Does it cause a stroke if you do the pellets? The pellets are still synthetic hormones. It doesn't matter whether you poke your arm, rub it on your skin, or put pellets that release slowly over time. It's synthetic phytosterols, no matter how you get it. Casey asks about mushroom coffee. No, I have not tried it. Henry is a hyperabsorber and he has no noticeable side effects with Zetia, and it dramatically reduced his LDL by 60%. So cut in half. John, you're very welcome. Thanks for being here. Thanks, you guys. I appreciate all of this, that you guys are here. Steph says, okay, I'm feeling like my cholesterol is not converting to hormones that I need. You could check a pregnenolone level. You could check a DHEA level. If your DHEA level is low, DHEAS, you could have an adrenal problem. Okay. Maybe stress. Like you said, stress makes everything worse and it increases your insulin and you become insulin resistant. So you need to sleep and get out in the sun and hug a tree and stand barefoot on the ground and pray and maybe take some GABA and do parasympathetic exercises. You're very welcome, Lynn. Steph says, I'll book an appointment with you. I feel like my numbers are confusing. That's okay. This is a lot, Steph. I've been studying this for the past 3-4 years and I still find it confusing. So we're all in this journey together. Don't beat yourself up. The numbers are going to be confusing, but maybe if we talk, we do a consultation, we can maybe unfold some of the things that are all trapped up in here and bogging you down, and we can get a better handle on it. Okay. And we'll learn together. We'll take your numbers and we'll both be learning. Okay. So, like I said, don't beat yourself up. The fact that you're here and you're asking very good questions is awesome. Okay. Dreezy said, once again, I had a heart calcium scan, which was 0. And if you've never had a heart attack and you have a 0 score, according to the MESA study and the power of 0, your chances of having a heart attack are very slim. But just look into it. If you have a high LDL, get an NMR. Maybe, just maybe, you get a CT angiogram with clearly. You check your blood clot factors. That could be simple as that. You check whether or not you're a hyperabsorber or a hyperproducer. Those are simple things, and you don't need to inject dye. There's a lot that still can be done to look into things, but getting a full picture, you don't need to keep checking stuff. And I'm not humongous on find a diagnosis and treat it kind of a deal, but you guys, hey, you're hungry to know what is going on with your blood, okay? You need to get a proper diagnosis, not just shoot a spray gun and just hit from every angle. Know a diagnosis so you can treat it appropriately. If it's something as easy as fatty liver backing up and causing high LDL, or your thyroid is not working very well, and it's not going to work very well if you got a choking liver. Remember, T4 converts to T3 mainly in the liver and kidney. So if your liver and kidney is under the weather, you're not going to be converting T4 to T3. And then you're going to be stuck with a bunch of reverse T3. So you got to look at everything. We're not just going to separate. We're not going to look at your levels from a silo. All of them connect. We connect the dots. We got to connect every dot. And we go down rabbit holes, but you guys will love it. The people who have had consultations with me, I feel that they are better off. They're in a better place. I love all those. It's good stuff. Dreesy says, what is GABA? GABA is a calming. It is secreted when our parasympathetic nervous system is activated. GABA is calming, glutamate is stimulating. Sympathetic nervous system is stimulating. Sympathetic, stimulate. Parasympathetic, relax, calm. If we are sympathetic overdrive to hyper sympathetic, then we don't have calming effects from parasympathetic. So we need to do exercises that calm us and increase parasympathetic nervous system. If we're working on that parasympathetic nervous system, sometimes if we take a little bit of GABA, a hormone that is released or secreted during parasympathetic stimulation, if we take GABA, it can help calm us and we could sleep better. And then we would learn all of the lowering of sympathetic. And then eventually we don't need anything and your body makes its own GABA. Okay. Good, good, good. Is there one test that you can take for blood clot factors? It depends on who your doctor is and what lab they order. Could they look up a blood clot panel? Sure, it might include a D dimer and a PT and INR, but I always look at those panels and make sure, is factor 5 there? Is factor 8 there? Is fibrinogen there? I want to make sure prothrombin is there. So it just depends. I would look up the blood clot factors and just make sure they're all present on your particular lab panel that your doctor ordered. Okay? It seems like when I'm ordering them for you guys, I order them separately instead of in a panel because I want to know what you're getting. Okay? Steph says you hit the nail on the head. I'm always in sympathetic overdrive. My mom is too, and she has the same stuff going on. Yeah. I mean, it's just how you were raised, and we all have childhood traumas, whether you know it or not. And you could have developed that over conscious stimulation where you're very hyper vigilant. You're always looking out. Your mind is going 50 miles an hour. You're thinking about the what ifs. You're thinking about the future. You're always trying to be one step ahead. Always worried or always wondering about what possibly can happen is increasing your parasympathetic tone, uh, or excuse me, your sympathetic tone. And if you don't sleep, that increases sympathetic tone as well. And the sympathetic tone is like a vicious cycle. It actually prevents you from going into deep sleep because you have learned to be hypervigilant with like sleeping with one eye open kind of a thing. Oh, I'm a light sleeper. You're not a light sleeper. You got sympathetic overdrive. Yes, you're a light sleeper because you have sympathetic overdrive. So usually these types of people are hyper overactive fixers, overactive, um, compassionate, empathetic helpers, that kind of person. They're all great qualities, but put you at odds with being able to relax. Even when you think you're relaxed, you're always scanning, hyper vigilant, thinking about, oh, I got to do this, I got to do that, oh, I'm going to look this up. And you could be the person who looks stuff up and it could take you 10 hours to look up uh, the right kind of laundry detergent. Okay, it's just sympathetic overdrive that can cause a heart attack all by itself, cause a blood clot. Oral, it's capsule. Is that what gabapentin is? Not quite, but yeah, same name, right? Gabapentin. But GABA is a little safer, I'd say. What exercises are calming? Um, Exercise in general hits sympathetic and then parasympathetic. So, the things that I probably don't do, it's just relaxation techniques, Ruth. I wouldn't say, a lot of people say that they're the calmest when they are exercising, but then when they stop, then everything starts racing again. I don't know. Everybody is different. For myself, I mean, for anybody, I remember when I was in college, We laid on the floor in the big gym, and all the lights were off and it was really dark in there, and they told us not to sleep, but to start relaxing from your head hair to your toes, and they walked you through a relaxation phase. Maybe it's massage, maybe I don't know what it is for you, Ruth, but you got to try to figure it out. Steph says, that's me. I don't feel like I worry all the time. I actually sleep great, but I'm always trying to get a step ahead. Like you said, per my aura and energy levels, I'm getting good sleep. Well, maybe you're not, though. I mean, do we believe everything that goes on our finger? I don't know. Okay. Okay. I probably missed a lot. I don't know if Lucy is still over there going through. North Dakota looks to be talking to somebody, Lance. Okay. But North Dakota says North Dakota carnivore came off of 5 blood pressure medicines. 5, not 1, 2, 3, 4, 5 blood pressure medicines. 2 statins. I doubt 2 statins, maybe 2 cholesterol lowering medications, but I don't think a doctor in their right mind would put somebody on 2 statins. Never seen it, never heard of that. And several other medicines by switching my diet away from plants. Not one is needed, but we can eat them when true food is low. Right. North Dakota carnivore. It is called a survival food for a reason. That's why they want inmates to just barely survive. So I'm going to give them rice, beans, and bread and water. Survival foods. Do you think that they would give that person a steak or ground beef or pork or any animal? No. They want them weak and just building the railroad. Reggie says that why we need you, because yes, you're saving lives, doctor. Your name and your wisdom is gaining traction. People need you. Hit the thumbs up, you guys. That's I see it, but hit the thumbs up. If you're listening right now and you haven't subscribed, hit the subscribe button. It helps the channel. I don't know how yet, but I think it will. I don't know. The super chats, the super stickers, the live fundraisers I do, it all helps me in some way, whether it's monetary or just something that I truly believe in, like rescue, rehab, and rehome. And I believe in my little Tootie girl's birthday and all those things. I believe in relaxing. Habaneros. My third and final cholesterol results were total cholesterol 449, HDL 96, triglycerides 159. Right there, your triglyceride to HDL ratio is still too high. Your triglycerides must be under 70. Something is raising your triglycerides. Okay. You need to look at your diet, reformulate what could be raising triglycerides. Is it glucose? Is it fructose? Is it seed oils? Is it stress? Is it coffee? Something is raising triglycerides. We got to get those down to below 70. And then you'll have a 70 divided by 96 level, and it will be less than 1, which is metabolically great. However, because you have high LDLs, you want to make sure that they're not plugging up the system, bumping into VLDLs, causing small dense LDLs, and raising your oxidative potential, causing plaque formation, a soft plaque, and then hard plaque. Lots to go over, habanero. Okay, Lucy's got to go. Hope everyone behaves and are respectful of your kindness. So far, so good, right, Lucy? Thank you so much. Have a blessed day, Lucy. I appreciate you being here. QQ says, oh, Penny, QQ, concerned about particle sizes. My total cholesterol is 188, HDL 84, awesome, trigs 38, LPL total particles, LDL total particles 1538. I'm guessing that's what you meant. Small are 222. So, yeah, this is where we get into trouble, Penny. Your pattern could be an A, but because you have, well, you don't really have a lot of LDL particles. I guess I don't know what the reference ranges, in order to see what the particle number is. That LDL total particles 1538. Is that really, really high? Is it moderately high, mildly high? Help me out here. I don't have an NMR in front of me. I don't look at those every single day. But you do have some small dense LDLs, and it doesn't appear, isn't less than 500 the cutoff? I'm not sure. Again, I would need more information. I'm sorry, Penny, I can't answer your question, but one, stop freaking out, because that causes stress, and then that causes all kinds of problems. So take a deep breath, calm down, and then wait and get the numbers, the optimal numbers. Okay. For now is good. Can I save my gallbladder with a 17 millimeter mass? I don't know. I don't know what your mass is. Pellets, do they cause strokes? I think any hormones could increase our risk of blood clotting. We just need to know our risk for blood clots. Um, QQQ, what level optimum D3K2 to take daily? My level is 60. I'm guessing that is your stored vitamin D level. Do you know your active vitamin D level? Is your 60 on? Is that a level that you are taking D3K2? If it is, I probably would stay there. Oh, you're on 5,000 daily. Okay. So you're on 5,000 daily of D, and I'm guessing K2 around 100, 200, 150, somewhere in there. But again, if you want to be completely accurate, get both levels of vitamin D. Get an active level and a stored level, and see what that ratio is. Okay. Not all stored, like that 60, can be converted to active vitamin D, the usable form. Okay. John says, sorry about that supplement. No problem. Are they utilized by the body? I take amino acid supplement. I would not take an amino acid supplement. They are individual amino acids that are usually denatured. You would benefit more from eating the steak, and you process the amino acids into a peptide chain. Okay. Allow your food to supplement you, not a synthetic supplement to supplement you, that are basically denatured. They're individualized. You can't just go and take a whole bunch of peptide chains. Bioidentical is still not identical to animal hormones, cholesterol. You're taking phytosterols. I don't think in your pellets you are taking bovine cholesterol to give you your testosterone and estrogen and progesterone. Just asking, April, just go check. Say, hey, where are these things? Where are these hormones from? Are they from plant sterols, or are they from animal cholesterol? Habanero says, I take tons of glycine. What's tons? How much? We all want to know. Curious minds want to know, how much glycine is habanero taking? Habanero says, I don't take zinc. I do take copper. Have you had your levels checked? Have you had a ceruloplasmin level check? Ceruloplasmin. Um, Cam says, I'm just an old nurse from Kansas City, still learning in life from you, and I'm 59. Cam, we're all learning, and you're not old at 59. Maybe at 60 you are. I mean, who knows? No, come on, I'm just kidding. Habanero says, I've spent several hours listening to Morley Robbins on copper. Hey, that's a great source. Everybody should learn from Morley Robbins when it comes to iron and copper and ceruloplasmin and hepcidin or hepcidin, however you want to say it, ferroportin, all of those terms, Morley Robbins is going to go to in depth. Morley Robbins has a book out. You can read Morley Robbins' book. I think that would probably be an awesome thing to do because I don't think we know enough about iron overload. I don't think we know enough about the minerals we are taking in our food when we are consuming processed synthetic foods. We don't know what we're getting as far as metals go. Okay. Charlie says fibroscan positive for fatty liver. What is your number? Did they give you a number on your FIB4 score? Can't lose weight, no alcohol, carbohydrate reduction, no sweets or soda. How do I reverse fatty liver? Supplements. No. You need to get what is your insulin level? You want an insulin level between 3 and 5. In your case, you might have to go no carb, 0. Just a little bit is choking your liver. Okay? Lower the insulin. Lower the insulin. Steph says Morley is amazing. I've taken his course at the Root Cause Institute. Nice. Highly recommend it. He has a ton of free resources on on the website and does free webinars often. I love listening to him, and maybe it's because he's older and he's more fatherly, and it just seems like he's very easy to listen to. And he talks, I think, in fairly simple terms where the average person can understand him. Okay. And if you have a great interviewer interviewing the interviewee, oh my gosh, that makes a big difference as well because, it's easy for us to just keep talking. But if we have a good podcast interviewer where they can kind of coax us and lead us into good questions, and he provides awesome answers, I think. Could he be wrong? Yeah, he could be wrong. You just never know, okay? Um, but right now, the things he brings up are, I mean, they're plausible. They're possible and they're probable. So I love listening to him. Charlie says insulin is 7. Well, you got it. Maybe you need to be at 3 in order to help get rid of your liver fat. If you are healthy enough, do some some sprinting. That will help reduce liver fat. There was a recent study on Medscape the other day talking about cold therapy and increasing um, brown adipose tissue or helping with beige tissue, which has more mitochondria, which increase ATP. That can help possibly with visceral fat. I mean, there's a lot to understand, but again, looking at your labs, you can make some changes. How about that? Does insulin resistance affect cholesterol? It absolutely does. So does salt restriction for that matter. That will affect insulin resistance, which affects cholesterol. Sandy says, Doc, how can one take care of the knees to avoid arthritis in the years? That's a loaded question. And I think your diet plays a role, your activities that you perform younger in life play a role. There's all kinds of stuff. I mean, it could be a little bit of genetic, but taking care of those joints is very important. And you want to eat a low inflammatory diet. Reggie says, what's your retainer fee? I have no retainer fee. I charge by the hour and I charge by the minute, so to speak. So if we talk for an hour, it's a fee. If it's 65 minutes, it's all by the minute. So I don't have any retainer. People don't retain me. So I'm not an attorney. Okay. Dennis is talking about being able to ferment something at home, increasing GLP and A1C. First day, I only had the urge to eat a couple of snacks all day and one meal. So, what could be the problem with that, Dennis? Maybe not taking in enough nutrients nutritionally. malnourished. I really believe that natural production of GLP, in this case, are you inducing more GLP than needed, and now you're not eating and you're not getting nutritional um, content? Hey, that's the birthday girl. Leave her alone. Henry says, I do squats and consume sufficient collagen. That's another point, Sandy. Henry brings up another one. We need to consume collagen and we need to build collagen and elastin throughout our life. And that requires eating appropriate foods that have proline, hydroxyproline, and glycine in them. Bone broth, skin off of animals, bones or tendons and cartilage. If we eat that, we will grow that, hopefully. Okay. And maybe, just maybe, we'll need to take a collagen bone broth supplement. I mean, maybe that's where you have to go. And yes, Countess Nina, can you get glycine from gelatin? Yes, that is a great source. You can actually get gelatin just all ground up into a powder. I mean, it is a powder, but they can put it in a specially marked bag saying eat this particular gelatin and grow hair and nails and joints and this and that. But yeah, we need collagen and elastin for our arteries to stay. I love your joints and I think you should love your joints, but what about your arteries carrying blood? They need collagen and elastin. Collagen for strength, elastin for the dynamic flexibility. If you are low in collagen and elastin, I'd be more worried about my arteries than my joints. Although I'm worried about my joints, but I'd be super worried about my arteries carrying the blood and getting all stiff like a lead pipe. I want them strong and very elastic, dynamic. Okay. Doctor, sympathetic overdrive is what stresses my cortisol. Absolutely. Absolutely, pets. It is a killer. And I think as a population need to work on sympathetic overdrive. It's, again, it might be going back and looking into childhood traumas and seeing, how you were raised and why you absolutely developed this sympathetic overdrive at such a young age, around 3, 4, 5, somewhere in there. Okay. John says, yes, I have post-traumatic stress disorder, Vietnam. You described it perfectly, hypervigilant. John, I thank you. Thank you for being, you know, in our military. Thank you for your service. Thank you for all of those things. And I am sorry that you are going through that. Um, that must be a horrible experience. I hope that you are in counseling and that you work any type of post-traumatic stress, whether it be childhood trauma or Vietnam or anything. It could be physical, it could be emotional trauma. We all have baggage, but we can work through it. If you are even aware of the fact that you have something going on makes you an excellent candidate to help yourself. Okay. And we just got to unpeel the layers and we work on increasing parasympathetic tone. Okay. All right. Pet cemetery. It's extra frustrating being metacognitively aware. Type A personality, always going, going. Yeah, I hear you. Oops, don't fall, buddy. Wayne says, I have PTSD from all the animal abuse I've seen in the UK and USA meat industry. I, I would agree, Wayne. It is a tremendous burden if you love animals, and I love animals. I can't even actually watch it. I mean, or hear about it. I have to turn it off. I can't even hardly. I would be saving all of these animals. I think it was on Instagram, and I watched a sheep that was allowed to grow without being sheared for years. It was carrying around, it couldn't even get up, you guys. What people do to abuse animals and what factories do to abuse animals and what large corporations do to, and you could be a small one person abuser. Okay. I'm not just saying it's all, but we need to be very cognitively aware what we are purchasing. Okay. If we're purchasing laundry detergent that was tested on beagles at Raglan or Reglan Farms, hey, I don't want any part of any of that. Okay. And I think, Wayne, you agree. I mean, it's disturbing what has come to our attention lately. What is going on? Okay. And they're all too interested in putting the person who's trying to rescue the dogs in jail. If you rescue a cow, you're going to be put in jail. It's it's unbelievable. Yes, it will be recorded. It'll be on replay, Habanero. You can go back and listen to it. Okay. I appreciate that. And share it. Share it with somebody who might want to hear it. Yeah, may the force be with us. I agree. And that force is our creator. Reggie, you're everywhere today, bro. Oh, that's funny. Yes, Reggie. You can do super chats, you can do super stickers. It helps my channel. It helps me. This is my job. I help you guys, and you help me help you. And yes, I will still be here. I love my live streams with you guys. I love doing reels. I love my consultations with you guys. It's fun. It is stressful because I don't want to mess up, but I do love it. I love sharing knowledge. I love teaching you guys, but I also need to survive. Okay. I'm I'm not the typical doctor seeing 40 patients in a day in an office making $300,000 a year. It's not me and probably never has been, but that is an option. I'm just not going to go there. Okay. I choose not to. Swimming, bike riding, yoga worked well for PTSD. So refreshing to hear the truth. You're very welcome, John. um, let's see. I'm just trying to read through. I'm looking for questions. Okay. I think any restricted diet is probably making people sick. Again, I'm an animal-based diet, but if I'm not eating organ meats, then I'm gonna have a problem. If I was a vegan and I only eat plants, I'm gonna have a problem with glycine, choline, carnosine, creatine, carnitine, all of them. I'm going to have a problem. It just is what it is. But I'm not going to eat a standard American diet. I prefer for myself an animal-based diet because I'm an animal. We're mammals. We are apex food chain. I mean, you can't get past that, but that doesn't mean that we abuse animals in order for us to survive. We don't. That is not how I look at it. Oh, thank you, Shirley, and thanks for being here. I appreciate it. Thank you, Reggie, for bringing this all to my attention. I appreciate it. Okay. Dreezy says, "Can I take Janine to bring down my A1C? What is that? My husband has diabetes, and he texts Jan, and his A1C comes down. Sorry, wouldn't that help me? You guys, just if you got diabetes, diabetes is carbohydrate toxicity, glucose toxicity. Don't take any more medicines. Get rid of the glucose. Get rid of the glucose. 94 is still too high. 70 to 80 fasting is normal, optimal. Which is gabapentin. Okay. I don't know what that is, but you don't have a deficiency of metformin or gabapentin. You have an overdose of glucose, carbohydrate toxicity. Okay. Um, okay, I can see you guys are fighting between vegans and carnivores. You guys can fight it out, duke it out. Yep, Henry, maybe cold baths are good for you, or cold showers, anti-inflammatory. It does help to build brown fat, not necessarily. It can we can't really take a white fat and make a brown fat, but we can make a beige fat. So we're going to increase mitochondria in that fat. So can't really go to brown, although we never really lose brown fat that's around our neck and our chest area. Um, God made us so when we went from a baby to an adult, we still kept some of our brown fat in the areas that are vital. I think to keep our heart warm and to keep our vital arteries to our brain warm. So the blood going to our brain is warmed up. I think maybe that's why he kept brown fat in our on our body. Buddy blue, buddy blue. Okay. Let's get through these. Let's get through these questions. Um, oh, you know what? Rob, I don't know much about soccer, but I know that that's going on. I don't know much about it. Okay. Yes, eggs are good for you, Robert. Who's the birthday girl? Her name is Tootsie. She is 7 years old today. And it's not, this is Buddy Blue. I had Tootsie on at the very beginning. Tootsie, my Tootie girl, is 7 today. And we're doing a fundraiser for rescue, rehab, and rehome. The link is in the description. Please hit it. And a $1 would help. We have $35 raised, and I would like to make 100 by the end of today. Can you guys help me do that? Look, it's not even for me. It's for dogs running on the streets of Oklahoma that are in kill shelters. Okay, let's try to save. If Buddy wouldn't have gotten saved, he at 30 days and he goes on death row. Okay, in Oklahoma, that's a kill state. They got 30 days. So at 28 days, they put if the dogs are not taken in Oklahoma or whatever kill state they're in, they get put. They're basically in 2 days they're taken off the market. Okay. Okay. Thank you, Dennis, for the $2. I appreciate that. Speak on guanfacine in tuna for sympathetic. Dennis, I wish I could speak to it. I don't know what that is. I'm sorry. Does insulin resistance affect cholesterol? Yeah. Linda, go back and watch this whole podcast, this whole show, and you might get the answer that you need. Frady Cat says, have an LP little a of 22. Is that a good thing? LP little a of less than 30 is probably just fine. All right. It's the other things I probably would want to look at your liver function and all of that. I didn't see a question, so maybe that could be why. Um, Last 3 toes doesn't bend normally. Why? I'm not sure, but with slight burning and slight pain, what type of problem is it? The last 3 toes, I mean, that is probably an L5 S1 coming out of your lumbar spine could be. Um, Hard to tell. I'm guessing L5 area. It could be sciatic. It could be piriformis syndrome. I'm not sure. I do not know. It's not rheumatoid arthritis, but what is it, please? I don't know. I wish I could answer your question, but I think you should see your doctor in regards to that. Okay. All right, you guys. We'll call it quits today. And Lord willing, we'll be back next Saturday, AM at 9 a.m. Central, 9 a.m. Central on Saturday, 10 a.m. Central on Sunday. Catch my reels through the week. If you would like to sign up for a consultation, email me at ironladydoc, IRON, iron lady, LADY, doc, DOC, at AOL.com, at AOL.com. If you want a list of labs, or you want me to order any labs that your doctor does not want to order for you, like an insulin level or a ceruloplasmin level or one of zinc or whatever you can't get your doctor to order, if you want me to order it for you, I can. And you email me as well and say, hey doc, can you order this to me? All I need is really is your email address and I can order it for you. And then you pick a lab that's near you, you go, you get your blood drawn, and you get the results sent to you in an email. Will I get it too? Yes. If you want me to go over it with you, I can, but that's not a requirement. I'll still order your labs if you want me to. Okay. All right. So we'll call it quits today, and I will be back, Lord willing, next Saturday. Buddy Blue and I. Okay. See you guys. And please hit the donation page for Rescue Rehab and Rehome, even if it's $1, even if it's $1, it's going to help for Tootsie's birthday and to save dogs that are on death row. All right. See you guys.